In that case, we can do some soft tissue mobilization to the temporalis. You can do some myofascial stretching of the temporalis by engaging the mandible or the jaw and providing a gentle stretch.
Technique. If we apply a little resistance underneath the jaw, and I can just ask Mika to slowly open and just apply a little more resistance to the left as she opens to assist with realigning the jaw, and then slowly close. Now we knew that Mika come all the way back closed. We knew that Mika was slightly deviating across to the right, so here I'm just applying a little more pressure. What we're going to do is come right in and underneath the mandible, and we're going to loosen up those muscles gently right up to the mentonian symphysis. Again, just working slowly and gently within the pain limits of your client until you can just start to feel some of those soft tissues soften. Okay, now again, using a little bit of cream, working on the local muscles around the jaw, working on the masseter, so just coming inferiorly underneath the zygomatic bone and just very gently releasing that muscle down to the inferior ramus of the mandible. Now here you can get a little bit of the inferior attachment of the temporalis. Okay.
Measurement device, and I just have her open. So she is measuring at 40 millimeters. Normal range of motion for jaw opening is 45 to 50 millimeters, so she's a little less than what would be optimal for opening and closing. And then we look at lateral deviation. So I line this up with the center of her teeth. I have her open her mouth just slightly and move her jaw to one side. So on that side she's at 15 millimeters, and the other side, and she's way more than 15 millimeters on that. So she has some asymmetry in her jaw motion laterally, but it's actually more range of motion than she needs. So there's clearly a problem with the joint. So that's just sort of the basics on how we begin an initial evaluation for the TMJ. I would go on to see how her jaw is moving and if there's any deviation there, just simply by feeling the joint and having her open. And it's very subtle, but you can see that she deviates slightly to the left as she opens. And there's also asymmetry in how the jaw is moving. So that is the basics of a TMJ evaluation. Goes into
neutral or an S curve where it's asymmetric throughout. You can also have the jaw deflect to one side or another. Go ahead and open. So if the jaw deflects to one side, that usually means that that is the side that has some restriction. The next one I'm going to do is mobilize the TMJ. So if I do find restriction on one side, what I'm going to do is place my thumb on your bottom teeth. So go ahead and open. And then let your jaw be nice and relaxed. And I have a grasp on the jaw, but she's comfortable and relaxed, and I'm palpating the joint here to see what's happening and giving a nice stabilization. And then I'm going to move that joint and assess the mobility there. We can decompress a joint that is tight or restricted, and if somebody has limited opening, I can mobilize that joint to facilitate a better movement pattern. So another thing that I can do to try to relax the muscles of the jaw, go ahead and relax your jaw, but teeth not touching, perfect, is I am feeling some of the muscles on the inside of the jaw as well as muscles on the outside of the jaw, and you can just do some soft tissue mobilization to release muscle tension and to treat the muscles that have tension.
What you do have to get into this position where you insert the pinky into the ear and apply an anterior glide again. Compare the right to the left. Is that tender?
Yes.
Yes. Now open the mouth up and I'll apply an anterior glide again. How about now?
Yes, it's still tender.
So what I was doing simply is applying an anterior glider force through the tip of the fat pad of my distal phalanx of my fifth.
And then I'm just going to do some soft tissue work on the sternocleidomastoid, beginning gently from the mastoid process, coming in slightly posteriorly and just working with that muscle all the way through to the clavicle and the sternum. Now you could just work with that muscle until you start to feel that those tissues are softening. And just going really slowly and gently. Some of these techniques open, and I'm going to come in gently and bring my finger to the outside of the teeth and gently close, but don't clench. Now I've reached my finger right to the back. I can feel that posterior ramus of the mandible. Now I'm reaching up underneath the zygomatic bone almost towards the corner of the eye. And this can be quite uncomfortable and the lateral pterygoid can become quite sore. So it's important just to very slowly, I'll get you to open gently, Mika. I'm going to just grasp the inferior teeth and the inferior ramus of the mandible and then just gently bring the jaw back comfortably. Now we're going to palpate the joint. Always just feel for how much movement you're gaining at the joint. You don't need to be rough or heavy-handed with the jaw. Gently apply a scooping action and
the heels are very nice. Just going to check again the bottom of the toes. Now that's a tricky thing. Sometimes you may want to put a mirror on the floor so that you can see if there's anything. Any soreness?
Nope.
Nope. Okay.
Check between the toes for any problems such as athlete's foot or fissuring.
Joint mobilization, soft tissue mobilization. We'll do instrument-assisted soft tissue mobilization. We'll do trigger point specific techniques. We'll use strain counter-strain techniques. We'll do manual therapy, and there are also lots of different tools that are used in manual therapy, of which here at the Des Moines University Clinic we do use a wide variety of manual therapy approaches. And what's most important is that we select the approach that is most appropriate for that patient. So
John, can you push your toes up towards your face and resist me? Up. That's fine, good. Now the opposite. Can you push them down and resist me? That's good. Just the big toe now, all the way up. And now push it down. That's fine, thank you.